Hello, my name's David Bradley and I'm Chief Executive here at SLAM, and I'm doing this video message to give you some key facts and up-to-date information about the coronavirus situation and what it means for us at SLAM. Now, I want to start off by giving a real big thank you to everyone who's been working really hard to keep our services going during this period. I know it's been difficult and it will get even more harder, but I just want to say a real thank you. I've been amazed at some of the stories that I've heard right across the organisation about how hard people are working, that bit extra that people are giving to make sure that the people that we provide services for are safe and that we can continue to provide services. So it's a great big thank you to all of the people who are working on wards, in community services, in our clinical services, but also people that are keeping these things going. So people, the porters, the catering staff, estates who are helping to keep this going, and people that you probably don't see day to day, but our IT colleagues who have made helping people to be able to work from home wherever possible happen. So a big thank you to them as well. So as an organisation, I've said that we want to make things easier for staff and to look after you. There's a number of things that we're going to do to try and make things easier. So we will be stopping the charges on car parking. We will be providing free meals for staff who are working during this period. Those at the Maudsley and the Bethlehem Hospital and Lambeth. Now obviously this is a changing situation and it changes each day, so it's really important that you keep up to date with what is happening. So please follow government advice, but locally for us within the organisation, make sure you look at the Maud homepage. There's a banner on there that will take you to the infection control pages and coronavirus pages that gives loads of information on there. Have a look at it. It's really helpful. And again, can I please ask you to treat people with respect and dignity. That's patients and all of us as staff. If somebody has tested positive, and lots of us will do over the next few months, so please let's treat each other with respect and dignity. We've spent many years trying to make sure we break down stigma in mental health. What we don't want this to is suddenly increase with the coronavirus. Now, I started this message by saying I've been really impressed with some of the really hard work that people have been doing, and I think it shows the best of people when there's situations like this. But unfortunately, we've also had some things that have gone missing. So lots of masks that are there to protect staff and to protect patients have gone missing. Could I ask you please, if you're on a ward and there is equipment, don't take it home. We are getting more and more masks that will be provided to the organisation in the next few days. Let's leave it at work where it is needed. So please pay attention to that. Don't take that. Don't take toilet rolls and hand washer. We'll provide as much as we can here. If anyone is in difficulty, if you're in difficulty at home, please let us know. We'll do whatever we can to support you. That may include advances of salary if people are struggling, if partners are not working and things, but let us know. So I know a lot of staff are anxious and worried about what's happening, and we want to help you as much as we can. We've set up a 24-hour advice line that you can call. The details are on Maud, but we're also working over the next few days to work up a package that can really help with some psychological support to people who have been affected by this or will be in the coming months. Now, we're really lucky at the Maudsley to have the support of such a fantastic charity, and they are giving us a lot of money to be able to help staff. So we'll be looking at packages to be able to help people that, as I say, can come out to a lot of community services as well. And we'll publish more details on that shortly. So I know that many people will have further questions, things that they want to ask. So starting next week on Tuesday and Thursdays, both myself and the chairman will be doing live question and answer sessions. We'll put those available over the intranet on Teams so that you can access those. Look out for those on Maud. Submit questions in advance if you've got those, but we will do those and answer as many questions as we can. So I'd just like to finish by saying a massive, massive thank you to everybody who's been working so hard to keep services going and to provide the care that we're doing day in, day out. Thank you. You're amazing. I'm really, really impressed with everything that people are doing here.